Hi, I'm Rich Lucas with HFMA. I'm here at HFMA's annual conference, and I'm excited to have a conversation with PayMedix CEO, Tom Policelli.
Hello.
Tom, welcome.
Thank you.
So, Tom, to start us off, the Commonwealth Healthcare Affordability Survey reported that 54% of people with employer coverage who reported delaying or foregoing care because of costs said a healthcare problem of theirs or a family member got worse because of it. How does PayMedix address the cost of care avoidance?
First, the problem is very huge. We all saw during COVID that when people couldn't get access to care or were afraid to get access to care, they showed up much sicker later on. And what this Commonwealth study shows is that that very same thing happens every day due to money, not a virus. People are scared that they can't pay for it, so they don't go in. And so when you look at the statistics, what you see is, particularly for lower income individuals within the employer segment, those lower income people are more likely to use the emergency room as their first point of contact with the healthcare system, just like Medicaid people do.
Right.
Their income is close to that. And so they're just showing up when everything's gone very, very wrong. And that's a terrible circumstance. What PayMedix does is we work with employers and we bake in for every single employee, regardless their credit rating, a full line of credit all the way up to their out-of-pocket maximum, so that all people can access care when they need it and not when they think they can afford it.
Wall Street Journal recently reported that 23% of what patients owe is now being collected upfront at hospitals. According to the data, that number is up 20% since last year. For lower income Americans, those upfront costs can be out of reach. What are the implications of this type of upfront collection practices?
So that drives the statistic we talked about a minute ago with the Commonwealth Fund. That makes that even worse, because now more people are told for scheduled services, if they can't post the money that the hospital estimates they will owe as their portion of the overall charge, then those people just don't show up. They don't have the money, right? 25% of our members today can't get credit anywhere else. They may have a credit card, but it's maxed out. And so those people are definitely in that statistic. They just simply can't do it. Now, if you're the hospital, I mean, there's plenty of hospitals here today. If you're the hospital, you're really stuck today between what looks like two very bad choices. PayMedix, thankfully, is the third choice that makes everything better. But the two choices hospitals feel they're stuck between today is, on the first hand, collect up front. As you heard in the statistic, 25% of the hospitals are now doing. And they feel they have to do that because if they don't, they're just not going to get paid. Their likelihood that they're going to collect the money that is due by the consumer after the insurance pays is not high, and it's been dropping. So the hospitals feel they're cornered and they have to do that. When they do that, though, they risk getting very bad press, as the Wall Street Journal article showed, and irritating their patients. So the second choice that providers have at this point is to just simply provide care and hope they get paid. Well, that doesn't really work out very well either. So PayMedix, as I said earlier, we step in and we guarantee all patients access to credit, no interest to the consumer, no fee to the consumer, so that they can access the care they need when they need it, and the providers don't need to demand money before they've even provided the care.
Well, I saw that PayMedix recently published a white paper. What did you find most impactful with that white paper?
Well, a lot of it was the money, as we've been talking about, and the financial issues and pressures that people have and feel. But the other thing that really came through was the overall sense of confusion. Consumers just do not understand the explanations of benefits they get from their insurance company, all the bills, how those things reconcile or don't, and people are overwhelmed. And all of the solutions that providers have been trying to put in place to get their yield up, financial yield up, is just creating more noise for the consumers. So it's interesting, as much as money is a big issue for consumers, it's number two. It's a close number two, but number one is confusion. They don't understand what on earth is going on. And that's what we sort out. We make all of that paperwork go away. All the EOBs from the insurance company are gone. All the provider bills are gone. Consumers get one statement, just like you do for your credit card or your cell phone bill or anything else. And they really like that.
Fantastic. So Tom, I've certainly enjoyed a chance to have a conversation with you. I hope you enjoy HFMA's conference.
Thank you very much.
It was very nice to meet you.
You too. Thank you.
All right, thank you.